a lot of images that come to mind for many of us when we hear the words living out your faith in the workplace are different. So if you could paint what that image is, faith in the workplace, what would be the details of that picture?
There we go, green. Who's got the volume switch? Ah, right. Okay, thank you. Well, let me start where I left off yesterday briefly, which was okay. Good. Now it's not echo. Okay, good. Yeah. For those of you who were yesterday, I alluded to the fact that and to C.S. Lewis's observation that believing that sitting in a church would turn you into a Christian is like believing sitting in a garage will turn you into a car. And that really came true to me when I was at the World Health Organization. Who's winning? Okay. Before coming back to MSH in 2004, I was at the World Health Organization for 10 years running the Essential Drugs Program. And there was a period about a year after the former Prime Minister of Norway, Gro Harlem Brundtland, came in as Director General. And I basically ended up with 2 jobs in 2 offices. One was, my day job was working on AIDS prices and patents and setting up the generic pre-qualification. So I had a $300 billion a year pharmaceutical industry beating on me during the day. And then I was asked to head up a task force on human resources reform for WHO. And I had the staff association beating on me in the off time. And I basically went into a workaholic crash. And I have 3 daughters, and my wife came to me and said, you need to move out. It's too disruptive. You're just not here. When you're here, you're not here. And she kept persisting. Finally, she got me to meet with our pastor, because I was going to church and playing drums. And she said, you got to learn how to give it up to God. So I said, okay. So I saw the pastor, and the pastor, we were having tea at a nice little, or coffee at a patisserie, and he gets out this chart and starts doing this crevice thing and faith and all that. And I said, Jim, I don't want to know about faith. I just want to know how to give it up to God. And he goes, oh. So that started a 3-year journey, and I realized that I didn't know how to pray, I didn't know how to read the Bible, and I wasn't really convinced. And when I was really in trouble, I was alone. And that journey was a journey which, at the end of which, it was a gradual process, a lot of reading, thinking, and at the end of it, I could sit down and write out my reasons for belief. And one of them, there were several examples, and we can use this, but one of the things was that there were 4 times over that period when I had a big disaster where one included at the World Health Assembly, which is hundreds of people collected, a big resolution around drugs, and then on a Friday afternoon, a 20-minute shouting match from across this huge room between the U.S. Political attaché in Geneva and the South African ambassador. And I went home, and this was when Dr. Brundtland just came in and had written all the directors and said, think about doing something else. I didn't even know if I was going to have a job. And it was a total disaster. And I went home, and I prayed. I still wasn't completely sure about that, but I prayed. It fell together. Next morning, we talked to the Norwegians and the Swazis and the French, and it all fell in. And there were several examples where there answered prayer. And that really convinced me. And the other thing was learning to pray for my, quote, enemies. That was amazingly peace creating. And so just in trying to get the work done there, and really do good, and I have to say, seeing just on the generic AIDS drugs, I mean, we buy now medicines for 1% of what we were paying 10 years, 15 years ago. It was $10,000 per person per year. We buy for PEPFAR and the Global Fund with $100 per person per year. I would not, I have no illusion that any of the things we did that I was had a contribution to, I could have done by myself. I couldn't have. It was too overwhelming. So that's just one example of I mean, I first had to get the faith and then bring it to work.
Thank you. You know, but if you had to paint a picture of faith in the workplace, what would that picture entail? Because a lot of us have very different notions of when you say faith in the workplace. Is it prayer? Is it Bible study? Like, what is it? And you shared that bringing prayer, of actually first believing it and then living it out through prayer when you had crisis was very key to seeing how faith was demonstrated in your projects. So anybody else?
I think it's easier to, for us who have, or who work with faith-based organizations, it's much easier to make faith, to live your faith because it's in an environment of faith. So for me, working at Loma Linda, which is a Christian institution, perhaps you don't get the kind of challenges, but that's not really always true, because even there, we as Christians don't always treat each other as we should. And I'm guilty of that myself. Because the challenges of working with students is a challenge that's not always, you know, how can you be demanding of good performance of a student and be very Christ-like in it? Because if you fail a student, she'll come out and say, I just got an email last night. Pamela was my TA for the last 2 years, and we got an email from a student saying, I don't believe I deserve a C+. So I guess I started praying, saying, well, Lord, I need to convince this student that she really deserves a C+. So so that's one challenge of working in a Christian institution where students are not supposed to fail, because the standards you set for them and you fail them demonstrates that this teacher is really not a Christian. How can he fail me, you know? So, but it's a challenge in the sense that then what I'll have to do now is to think of how best to really Christianly reply to this student, who was really not the best of students in the class, and Pamela knows that. So Pamela will be my witness in my Christian reply to this student. So that's one of the challenges of working in a Christian institution, where the standards may appear to students as punitive. You demand performance, you demand quality work, you demand well done papers and so on. So that's to me, that's the challenge I face. On the other hand is the competitiveness of having of grants. That's where you really see how Christian academicians function, is when there is money. You know, when you get a grant and suddenly money becomes the top priority. So Christ is put in the back burner, and we start talking money. You know, is how much percentage are you going to be on the grant? Well, 50%. Oh no, that's too much. Maybe 20%, maybe 10%, maybe 5%. Oh yeah, 5% is okay, but I'll be at 50%. Those are some of the challenges, how to share equally, really, by saying, well, you know, you have put in this much work on the grant. and I put in this much, I think we both deserve, or you and I, or we all deserve a certain percentage, and this is how much time we are really, honestly, truthfully going to be putting in the work. So those are some of the challenges where you assume that as Christians we ought to be fair and just and loving and lovable and all that good stuff that we hear. How do you really demonstrate that? To me, that's one of the challenges I face working in a Christian institution.
Thank you. And if any of you, maybe Dr. Edwards would answer this. What would you say is God's vision for a Christian professional?
I think somebody's answering for me. Go to page 3 and you'll find. I think for me, the safest place to go back to is the Bible in every way, because sometimes we seem to have what I feel is called academic arrogance. We think we know it all, or we think we know what God wants for our lives or for the profession that we are called to. And Paul says that he prays continuously for the Colossians that they may be filled with the knowledge of God's will, with all wisdom and spiritual understanding. So it's not that we have arrived, it's a process of daily going back to God and committing every situation, whether it's dealing with international projects or teaching with students or dealing with our colleagues and having being subjected to the pressure to conform. It's something that you're constantly made to compromise your Christian principles, at least at Hopkins, and I'm sure people like Dr. Mosley and others who studied at Hopkins can appreciate this, that sometimes the other faiths are celebrated and appreciated. You can say the words inshallah and nobody would be antagonized. But the moment you say Merry Christmas or Happy Easter or something related to Christ, you've brought about a division. And it's really difficult to identify yourself with Christ, but you continue to do that. And not to lose the identity of who you are in Christ. And as Paul says, faith without works is dead. It's not that you have one and not the other. Sometimes we have our works, but that's all directed to us. We make idols of ourselves. Just because I'm kind and forgiving and gentle and understanding doesn't make me Jesus. The Bible says, all have sinned and fallen short of the glory of God. So if I don't point people to Christ, who's flawless, who's the answer to eternal life, and in healthcare we're all talking about extending healthy years of life and saving lives, but we never talk about the concept of eternal life. And so you have to have that in mind on a daily basis in your interactions and in your projects.
Thank you so much. And it's interesting hearing what you have all said, and having started my education in a secular university and then going to a university that was Christian and expecting a different level of standards. And I think that some of you in your workplace, as soon as people know that you're Christian, we obviously set a different bar of expectations for you, and negotiating being human, at the same time being somebody who is supposed to reflect the image of Christ and point people to Christ that way can be a challenge. And I hope one of you will speak to that. One of our questions that John actually wanted to talk to was exactly that. How do you pursue professional excellence while maintaining an uncompromising devotion for God? She's coming.
Well, I actually don't think, well, from my point of view, it wouldn't be possible to pursue professional excellence without being solid and grounded in God. I find the worst days are the ones where I get up and miss the morning prayer and and try to do it myself. But I have to say, as a sort of a Christian leader of a secular organization, one of the things I wrestle with is the potential for sort of religious harassment, and it's really kind of tricky. We actually had a very interesting series of discussions which Douglas helped lead us through probably now, that was maybe 8 years ago, 7 years ago, to define our approach to faith-based organizations and all. And it was a good conversation, and it helped flesh out the counter-arguments, and people had amazing things like, you know, stories of organizations that wouldn't give a antibiotic for a pneumonia until the person converted and that sort of stuff. I mean, it was an amazing conversation, but we came down to 3 principles. One principle is that faith is a matter of personal choice and not, you know, something that we have a view on. The second is that we work based on our shared interest in global health, in public health, in the well-being of people. And the third is that we work with organizations that are basically in line with mainstream public health beliefs. And that's actually served us well, because then people are clear. But if I can share one story of the kind of pushback you get. 2 years ago, I did a session here with my oldest daughter on the science of, basically the science of faith and longevity in the context of chronic disease. There's actually the textbook, the handbook of medicine and religion is this thick. The literature has gotten much stronger. There's a good evidence base around risk factors. But when I decided to do the session here as a brown bag lunchtime seminar at MSH, the chairman of the board was quite concerned, and we had kind of a mixed audience in terms of the response. One really prickly question was, I was citing the data about prayer and well-being and all, and one of the people said, yeah, but you know, I have a dog, and I have a really good feeling from my dog, and isn't that about the same? So it's a tricky balance of, and I sort of said, well, yeah, it's and both, not either or. But getting the right sort of presence is tricky, and there's definitely a pushback there at times.
Thank you so much. And Ms. Kathy, how would you define the role of faith in your current or past public health practice or service?
Well, I've been waiting for this question, so if you're ready to leave at 10 o'clock tonight, that's when. I'd like to share with you a little bit about my years in Afghanistan. I was there for about 15 years and learnt probably more than I could pass on to anyone else. As you probably know, Afghanistan is about 99% Muslim, and often it's a faith cultural issue, so it's often very difficult to separate those. But Islam affects every single part of your daily life. From your greetings, assalamu alaikum, passing on the peace. When you walk into a room, salam. You pray before a meal. You greet people when you leave the room. The greetings are all blessings. So everything in the smallness of the day is associated with the faith, as well as the politics, the governing of the country. When I first went there, the Mujahideen were in power, and they had a theological reason for the war. And then the Taliban came, and they had a theological reason for the war. And I know that Mr. Karzai's government has a theological reason for its policies. So everything in this wonderful, wonderful country is based on faith. It all comes back to that reason. So here I go as a Christian, and I'm hearing inshallah and kismet by fate, and I'm thinking, my goodness, I hope that as a Christian I can pass on, that we can together change fate. I'm thinking about mother and child health. People in Afghanistan, out of their faith, had assumptions about me. I'm an American. Well, at that time I wasn't, and I didn't want to be. I'll tell you that story later if you're interested. But who would want? I wasn't an American, and they assumed that I was an American and a Christian, and they put together all the bad impressions that they have of Americans, pornography, immorality, overeating, overabundance, and put that together with Christianity, and it doesn't make a good mix. So I really felt at a huge disadvantage. But a crisis is a dangerous opportunity. And so I realized that living out my faith as a nurse midwife in Afghanistan was going to be the way to share it before I had permission to say anything. I have learned over the years that relationship is everything. In Afghanistan, relationship is everything. I am all for excellence in practice. I've nearly killed myself trying to be excellent in practice until I realized that in our faith there is also grace and forgiveness. So I want to say to us all today, as we strive for excellence, there is also grace and there is forgiveness. And it's so important to practice that for ourselves, but also for the community that we're modeling to. And I was modeling that in a Muslim community. I am so struck by relationships in the Bible, the 10 Commandments, all about relationships, the Beatitudes, all about relationships. Who are the peacemakers? Who are the merciful? I'm so struck by the Lord's Prayer. It's all about relationships. And so I tried to take that to my neighbors, to the community health workers I was working with, to the staff at the office, and tried to make it my whole life. And sometimes I had permission to speak about Jesus. I went to Jumpked, and Jumpked was another conversion experience because I believe that it's the closest thing to the kingdom of God that we will find this side of heaven. I hope you don't mind. That might offend some people to say that so categorically, but to see the transformation there was something to dream about in my dream country of Afghanistan, where I had my share of being spat at, where I had my share of having stones thrown. If we could only reach women, to be able to reach women, to be able to help women to stand up straight, to reach their communities, what a fantastic opportunity as a Christian health professional in a country like Afghanistan.
Thank you so much. You raised two important things. One of them is interfaith dialogue. Just being aware that when you're in a room or when you get into a community, you're going to meet people that come from different faith traditions and that don't always necessarily have a very good view of your faith, or that you yourself have biases against other faiths. And how do you work through that so you can then come to a common goal as faith practitioners to achieve health for our community? Another thing that I heard you say was, where is the room for grace and forgiveness and in interfaith dialogue? And something struck me early on in a class. Loma Linda University is a very small, the School of Public Health is very small, but has students from at least 80 different nations with at least very, very nearly 70 different faith backgrounds, some of them that I have never even heard about. But bringing all those students together and teaching them to do public health professional work together that's informed by diverse faith cultures and traditions has been an interesting growth part, but also a challenge. And sometimes, like you said, our faith, people relate traumatic experiences with our faith traditions. If you're Christian and your faith at some point has done atrocities to other people, that's when somebody sees you as a Christian, that's what they see. And sometimes your faith has actually implicated people from other faiths. So where is the room for acknowledging that there's room for forgiveness and admitting that, yes, some people from my faith traditions may have done A, B, C, D to your faith, but there's grace, and how do you turn that around to pursue a common goal for the health of communities? So thank you for sharing that. So my next question is actually in line with what you've shared, and what some people have concerns for participating in interfaith dialogue because they think it's a threat to their own faith values. Like, I'm a Christian going to live in a Muslim country, and sometimes my worry is going to be that interacting with people from a faith other than my own would compromise my own faith tradition. What would you say about that? And any of you can respond. Is that a valid threat?
I was born and raised in a Muslim country, Saudi Arabia. My parents were there for 28 years, and we had an underground church. But I watched my father minister to the Saudis, and it was difficult to go shopping or marketing because they would never take cash from him. But it was the love of God that he exhibited to them, and he was there with them in any kind of danger, in any crises. So it was easier for him to speak Christ through what he did. And I learned to do that with my students, though I'm Indian, and we have close to 3 million gods in India, and we relate to Hindu students. They're always looking for ways where you're going to fail or fall short of the standards that you talked about. So it's a constant sacrifice of your life and submitting yourself to God and the grace of God and the forgiveness of God and transmitting that message to people. And I've seen many Palestinians who, we had a lot of international students in India in a university of 50,000 people, and there was always a contention between the Muslims and Hindus and Christians. And the dean was always calling on my help to mitigate all these wars between the different cultures and countries. And it was really interesting to watch. Their perspectives were so different, and their thinking was very different from the way we are taught to think as Christians. To them, it was honor. When a friend of theirs was insulted, they had to kill him. And that's the way they were raised in Palestine. So just trying to understand their paradigm of thinking and appreciate, and at the same time transform them through your love and through the person of Christ, imitating how Christ would individually deal with them, is how you begin to give your values as a Christian.
One of the ways we've done it in the classes that I teach at Loma Linda is to recognize what Pamela just said about having students from, we are School of Public Health at Loma Linda is not very big, but we have over 80 countries represented in the school. We have students from Saudi, Pakistan, Afghanistan, yes, and India, African students. We have students from all over the world. But when I started teaching at Loma Linda, I realized that being Adventism being the religion of the institution, you tend to overlook what others bring to the institution. So I started actually asking students in the class to have an inspirational reading or sharing of their own stories of faith. And it has really become sort of when I don't do it in the class, students often ask, how come you haven't done it? And so students in my class will share. We have had some very inspiring stories of faith. And in the last seminar in global health that we just finished teaching, we have a Hindu student, and she shared her own understanding of God. But what struck me the most was the fact that she actually said a Christian prayer at the end of her presentation. And I just couldn't believe that. I mean, she shared a story of faith from a Hindu perspective, and her reading was a very well done poem of a Christian prayer. So I think as a dominant faith, sometimes we do indeed ignore the ones who are of other faiths. But I think we can raise them to an awareness of our own faith by being conscious of their presence, particularly at an institution such as Loma Linda, where we are the owners of the institution as Adventists. But I believe that has helped us to understand how others relate to us as well. Thank you.
And we have actually had students who have said, Adventist students who have said that learning and appreciating other people's faith has actually helped them understand their own faith better and make better commitments from their faith to become better public health practitioners. So sometimes what people fear is going to happen when they open themselves up to appreciating other people has been the opposite, which has been very, very empowering. But another thing that has been a challenge and that we are growing out of is learning that when we serve in communities, we find that the communities that we go into sometimes are from different faiths, but then their faith beliefs affect their health outcomes. So how do we learn, and I'm sure some people in the audience will share this, how do we learn what these faith traditions are and how they affect the very health outcomes that we are coming into the community to serve and to help reduce? And that has been very, very key. And at least my training as a public health professional who is going to serve in diverse communities that don't share my faith. And yet it's very key that I understand how their faith beliefs affect the health outcomes that I'm trying to impact. And we have one last question before.
May I comment?
Sure, please.
I'd just like to comment briefly on what Pamela said. One of the great prayers in my life is that God would give me very big ears and a very small mouth, so that I would be able to really hear what people are saying. You know, I rush in with my assumptions, and I really don't hear what's being said between the lines. And I've worked a lot with training community health workers, and the last time I was in Afghanistan, I was talking to the village midwife, who was not someone I was training. She had learned from her mother, who'd learned from her mother, who'd learned from her mother. And I was asking two things. I was asking, what do you do when a mother is hemorrhaging? And she looked at me as though I was quite silly. Why? How does this woman who calls herself a midwife not know this? She said, Kathy, John, dear Kathy, thank you. What I do is I take her by the ears, I pull her ears, and I shout at her, and I beat her. Oh my goodness, I didn't quite know how to respond to that. But in the rest of my questions to her and from a gray-haired lady in the community, which means that she's wise, my conclusion is that in an obstetric emergency, she was exorcising a jinn, an evil spirit. And I needed to know that for training community health workers, for their context. And who am I as a Christian? What's my theology about evil spirits? And how does that connect? And what should I do about that? And then I learned that, where are the jinns? Well, they're in the dust. And the lady said to me, you know, Afghanistan's got more jinns than anywhere else in the world. I said, how's that? Well, in our village, because this was in a valley of 52 villages, there was one tree. She said, there's so much dust. She said, but if you go to the city just an hour away, there are so few jinns. And I said, why is that? She said, there's a paved road, there's a hospital, there are schools, education and development. Is that what she was telling me? So I'm still growing these big ears. Please pray for me to really understand what people are saying and to be able to respond in that context as a Christian.
Thank you so much.
Can I add one short thing on the list? So I don't know why we're so fixed on Afghanistan, but another story from there. So you look at, MSH has done a lot of work in Afghanistan since the 1970s. When the Russians move out, we move in. When they come in, we go. When the Taliban come in, we go. When they go out, we come. But since after the Taliban left, we came back and worked to help rebuild the health system. One of the issues was family planning, and you sort of say, "Oh, these Muslims, what are we going to do?" But we actually saw that there were differences in utilization, so we said, "Let's see what we can do to scale up family planning." Well, once we started listening, we found out that the people we thought were our friends were working against us, and the people we thought didn't want to talk to us were ready to help us. What I mean by that is the health workers, their heads were full of all sorts of crazy ideas, and they were actually undermining family planning. But when we actually, and again, Douglas Hubert, literally sitting on the carpet with the mullahs and imams, they didn't want to talk about family planning, but they did want to talk about healthy children, because that's an obligation in the Holy Quran is healthy children. And so when we reframed it into healthy birth spacing, in the areas that we worked in, over 18 months, we got double or triple or quadruple the family planning coverage. getting to rates in some places that took places in Africa 10 years to get there. So the whole thing about listening and finding out where the positive drivers in any faith community are for health.
Thank you so much, and that's key, because what we have found in our social justice groups at Loma Linda with students from different groups is that for each of us in our faith, there's values about social justice, and we express them differently. So working with other faith traditions to know how they express social justice has become very key in working together as interfaith public health professionals to advance what our goals are for communities. And in that line, I have one more question before we open up to audiences, and that is, what are some of the cultural faith situations that have made your workplaces more challenging, or your work challenging?
Some kinds of cultural beliefs are not as harmful, but some can be fatal. And so when you get into households, and again, going back into the analogy of Afghanistan, we were conducting national surveys. We asked the women about relationships with husbands and decision-making. And strangely, many of them said, we want to be beaten up by our husbands. It's a sign of their love for us, that they still care about us, that they notice us. If we are not, then that means they're looking at other women and they've lost interest in us. And then when you go down to immunization, there was this man who said, I would rather my wife dies at home and goes to heaven and be reassured, rather than me going to Western medicine and clinics and her going to hell. So when you come to such vital life events, it's very hard to be understanding and have dialogues and get to knowing them and get to knowing their religion. You just don't have time for that. There's a fatality or vital event that's about to occur, and you just have to act. And that's not the time you turn the other cheek and appreciate their faith. So there were times when we've been faced with such situations, when you just have to move ahead and then go back and rectify the damage that was caused.
I think what's very difficult is to realize that some of these problems do occur even among us Christians. We did a survey in Zimbabwe, Malawi, Mozambique, and Zambia, looking at how the church responded to HIV. And it was really very disturbing to see how the church was the last organization that responded to HIV. That has left a blemish on the church because obviously while in the West it was associated with the gay community, for us in Africa it was predominantly among heterosexuals. So if you had HIV, you were promiscuous, and therefore you did not, you were not obedient, and you misbehaved, and that was the challenge that we faced as a church in Africa, and continue to face to this day. There were the church refused to baptize people who were those who immerse. There were even some churches that were contemplating having separate baptismal pools, or going to the river instead of having baptistries in the church. For those who do foot washing for communion, the church refused to, they almost wanted to have people tested. So those were some of the challenges that the church has faced, where as a physician, as a Christian physician, you say to yourself, can they not see that this is just plain wrong, not just from a religious point of view, but from a Christian, from a very Christian point of view. I struggled with that myself with my own church in Africa, where we were literally told never to talk about prevention with condoms. We were told that should never be, and our language was, yes, we are not standing on the street sides of Blantyre or in Malawi peddling condoms. What we are saying is, for goodness sake, if you do choose to live a promiscuous lifestyle, you can protect yourself and protect the other person as well. But the best is to be faithful and to abstain. And that caused a lot of rift in the church to this day. And so I look at that as one of the most difficult challenges that I personally have to face as a Christian believer in the church.
A few minutes to the next session, which is the photograph, and we want to be respectful of that. So does anybody in the audience have any comments? And what I would like to let you think about is faith important in your public health practice, and why? Is expressing your faith through your work or your deeds important for you, and why? But does anybody have any question for our plenaries? Or any comment?
I have a couple of comments and then a quick question. Ann Peterson. The church has certainly been very mixed. In my own experience on AIDS in Africa is very mixed. Some of the churches were first, some of them were last. I have a story. I love Afghanistan. I've spent a lot of time there, but my story is actually Pakistan. I was with USAID, and we were talking about different partners with the Ministry of Health in Pakistan. And they said to me, and I don't even remember the context, we have a program and we're hiring World Vision to do that program with our government money. And I said, you're hiring World Vision with Islam, government of Islam of Pakistan. And they said, I said, do you know they are a Christian organization? And they said, yes. Well, of course we know they're a Christian organization, but they are an organization with integrity. We know that they will take our money and that they will do well with it. They won't lose it and do bad things with it. So that seems like a model that we are all called to. So here's my situation in question. I went to meet with Jono one time about some work, and he's a Christian leader, which I did not know, of a secular organization, and we're in work conversations. And he said, if you're thinking about your career, why don't you read this book? If you want to walk on water, you have to get out of the boat. A very Christian book about career changes and living out what God calls on your life. My question is, one to Jono, how did you have the courage to do that faith outreach in a secular situation, and how do we or each of you be that model in your workplace where we know that the others are holding us to a higher standard in integrity, and we ourselves hold the church and our Christian brothers to a higher standard?
I hadn't realized I recommended that. That's a great book, and it's good. It's a great, yeah, and I reread it. It's a good book even if you're not transitioning. I do it with care because what's interesting, if you look at, it's really disturbing. If you look at the data over the last 20 years about the attitude of Americans toward Christians, the positivity, the polls have gotten distinctly worse. 2/3 of the people who have negative impressions of Christians have had a personal negative experience where they felt judged or whatever. And so, I've tried to be not sort of so in your face about it, but just find the opportunities as they come up. And I think the one, I'm really glad I went ahead and did the one about faith and the science of faith and longevity, because there is evidence. I mean, my goodness. And certainly there's one, I'm not sure the data is so good, but just on the evidence of regular church going, exercise, and statins for cardiovascular disease, going to church is pretty cost effective when you actually look at the data. So I try to find the common points, and that's the main thing. I mean, if the conversation is sort of believers against non-believers, then it's a nose to nose. Where if it's what is our common purpose in health, and then on that journey toward a common purpose, then you start discovering things. And there's no evidence that atheism gets you anywhere. So I think the evidence is with us back to the previous session.
Well, our time is out, but thank you so much for listening and for sharing, and I pray that as you continue to think through what it means for you to express your faith in the workplace, that God will empower you to fulfill your purposes for our generation. Thank you so much, our panelists.